A 55-year-old gentleman presented with epigastric pain and early satiety. He is otherwise fit and well. Following the completion of staging investigations, he was diagnosed with a T3N1M0 gastric adenocarcinoma. Which categories of patients with gastric cancer are normally offered neoadjuvant or adjuvant treatment?
Neoadjuvant chemotherapy is offered to all fit patients with non-junctional gastric cancer of T2 stage or higher and any end stage. Following resection, the more radical adjuvant chemoradiotherapy plus chemotherapy, or simply chemotherapy alone, are options in pathologic T3 and T4 disease or node-positive disease. It is notable, though, that radiotherapy is a standard of care base on American rather than European guidelines. The more radical option should be considered if an adequate D2 dissection has not been performed. Radiotherapy may have a role in a subset of non-responders who consent for more aggressive neoadjuvant treatment. This may be omitted in lower-risk patients with localized distal disease with no obvious lymph nodes on staging. The FLOT regime includes 5-fluorouracil, leucovorin, oxaliplatin, and docetaxel, and has been shown to improve overall survival in gastric cancer.
Can you describe the different cancer groups included in the CVOT classification and its current application in practice?
Type 1 tumors are those located in the distal esophagus within 1 to 5 centimeters proximal to the anatomical cardia. Type 3 tumors are located within 2 to 5 centimeters distal to the anatomical cardia and invade the esophagogastric junction. And type 2, which is true junctional or cardia cancer, is located 1 centimeter above to 2 centimeters below anatomical cardia. There have been changes in the staging of cardia and subcardia cancers. In the 7th edition of the American Joint Committee on Cancer, type 2 and type 3 cancers are staged and therefore managed similarly to adenocarcinoma of the esophagus. However, in the 8th edition, type 2 cancers with invasion of the esophagogastric junction are staged using the esophageal cancer staging system, while type 2 cancers without esophagogastric junction invasion and type 3 cancers are staged using the gastric cancer staging system. The recommended lymph node yield is 15 for early-stage gastric cancer and 25 for advanced-stage gastric cancer.